The question of vaccines for children has never been far away. But as schools return, the government's vaccine advisors have said no to jabs for younger teenagers.
I don't think it's a confusing decision. I think it's quite clear that the risks and benefits are finely balanced, but that other wider considerations such as educational benefits need to be taken into consideration before recommending universal vaccination for well children.
But Lisa, who's more vulnerable herself to COVID, wants her children vaccinated now.
Dumbfounded, really. I've got no idea how they've reached that conclusion. It seems like we're the outlier again in comparison with the rest of the world. France, over 40% of eligible children have been vaccinated, millions done across America. I'd love to see the data in terms of educational disruption as well. I have no idea how they've reached that conclusion.
The Joint Committee on Vaccines and Immunisation's main concern was a link to incredibly rare cases of heart inflammation. 200,000 more young teenagers with heart, lung and liver conditions will now be able to get the vaccine, but it hasn't been recommended for healthy 12 to 15-year-olds.
The chief medical officers are now going to be looking at this issue of vaccinating children, and they'll look too at the wider context. So to give you a sense of where we are with the data, in England, around 1 in 70 people had COVID last week. That's level with the week before. And you can see there in Scotland, the number is 1 in 75. That is a significant increase on the week before. And worth saying, it is the highest level in Scotland since estimates began. And of course, schools have been open there for longer. And if we compare that data, the data for England, to where we were last year, you can see there is a stark contrast. Remember, this time last year, there were still local lockdowns. We were about to see in a few weeks a rule of 6 coming back into force. But the level of infection now, at the start of this month, is 28 times higher than last year. And that's before schools start and classrooms mix.
Increasing vaccination coverage will have some effect on reducing transmission, but it's still really not clear how much benefit vaccinating that age group would have on reducing transmission in society.
The JCVI only look at health issues. The chief medical officers will now be looking at the wider context, like disruption to education. They're expected to make their recommendations within days, and the government will then have the final say. Ali Fortescue, Sky News.